This video is going to be covering the gastrointestinal conditions, or the back half of the slides for the gastrointestinal. So first up here is nausea, vomiting, and diarrhea. So again, as a human being, most of us experience this with some occurrence. It's just part of how we obtain nutrients and obtain nourishment, and a lot of times what we eat results in digestional problems. It's not new. So things like viral issues or food poisoning sometimes, and these have gained so much light in recent years. I remember as a kid growing up, I rarely heard about these, but Crohn's disease, inflammatory bowel disease, ulcerative colitis, pancreatitis, various stomach issues, dietary issues, celiac disease, food allergies. There's a lot of research going into milk. So, anyway, so much goes in there. Stress. One thing that's kind of interesting is in the nervous system, we used to just divide the parasympathetic and sympathetic nervous system, and part of the parasympathetic nervous system was something called the enteric nervous system. Maybe I can actually grab a video of this real fast, or a parasympathetic and enteric nervous system. These used to be included in the same classification. Let's see if we can find it here. I don't know if I might not be good to do this right off the cuff, but we used to do this. We used to just include this as part of the parasympathetic nervous system, but it's gained enough light that now the enteric nervous system here that controls most of our bowel function is actually it's becoming considered part of its own division of the nervous system instead of just a subdivision of the parasympathetic nervous system. So anyway, that's kind of interesting. Typically, it's been lumped here, but there's a lot of work going into including it in its own nervous system. So anyway, that's kind of interesting. And the reason I bring that up is stress. Stress can significantly impact our digestion and our stomach compatibility. So if someone is experiencing nausea, vomiting, diarrhea, there's a lot of good over-the-counter medications that can help manage. When to refer. If the symptoms are lasting a long time, if we have unusual pain, or if there's a fever. Again, if we notice something unusual, blood, darkened blood, some unusual mucus, that would be times where we would probably want to refer. The treatment, so anti-nausea, right? Anti-throwing up agents. Avoid fluids for 1 hour after vomiting spell, but just remember most of us have experienced this after we throw up or we have diarrhea. A lot of us get really thirsty. We're often dehydrated. So it's important to get fluids quickly and often when we're feeling these things. And then there's this brat diet that's become popular: bananas, rice, applesauce, toast. And then able to play as tolerable. So now we're just going to roll through a few of these specific conditions that, again, I assume that most of us are pretty familiar with, just being humans. So the first one is viral, gastroenteritis. Viral, so it's caused by a virus. Gastro, stomach, and then inflammation, right? So stomach and bowel inflammation caused by a virus. Viral inflammation of the stomach intestines. Usually resolves within 2 to 3 days. It's contagious. Signs and symptoms: watery diarrhea, nausea, maybe with or without vomiting, fever, aches, chills. It's that common sickness. Treatment: over-the-counter medications. We're going to try to use diet to help control those symptoms. If there's something that's bothering the individuals or the athletes, let's get them away with that. And then if no response to over-the-counter meds, symptoms for greater than 48 hours, then we will want to refer. And then stay hydrated. Hopefully those symptoms will go away. So food poisoning, I think a lot of us have had this before, often due to poor handling, cooking, and treatment of foods, not inherent infection. I've had several athletes with salmonella Salmonella can often last into that week to 10 days, which is just so hard, such a bummer. Hard to manage. So we'll usually know quicker if it's more of a staph bacteria. Okay, so we'll know quicker. Again, signs and symptoms: diarrhea, abdominal cramping, fever. Treatment: over-the-counter medications. Get plenty of sleep. Try to eat well. If we notice any blood or anything unusual, then we'll refer. Parasites. We don't have as many problems with these here in the United States. However, they still do pop up, and we see recalls for them fairly often in some of our foods. So protozoa from Giardia. If you're drinking sketchy water, I would never recommend to drink sketchy water. Take a filter with you if you're ever drinking water out of a stream or a lake. Tapeworms, roundworms, flukes. So again, signs and symptoms: diarrhea, significant gas, cramping, bloating. If it is one of these, they can work out on their own. It usually takes a long time. These worms will often have to have some type of medication. And so we will refer if we start to notice anything unusual in our patients. From time to time, you'll hear stories about individuals that are eating, but they won't be gaining weight. In fact, a lot of times they'll be losing weight. They'll be having constant low-grade diarrhea, abdominal cramping, bloating. You'll just hear those stories, and from time to time, we still have people that will get these worms and get in there and wreak havoc inside of the intestines. This is that song, right? The Pepto-Bismol song: nausea, heartburn, indigestion, upset stomach, diarrhea. See these commercials so often. So these are the stress-induced GI symptoms. If you don't think anything else is wrong, no fever, no sign of virus, no feeling bad, but it's still just diarrhea, it's still heartburn, it's still just problems. A lot of times it can be stress-induced. This is going to go back to our mental health and rehab class, but what can we do to help our athletes reduce that stress? We can use over-the-counter medications to help manage symptoms, but we have to attack the cause. And so we might consider referral to a professional that can help reduce some of that stress. Constipation here is unfortunate, but it happens, where people have a tough time passing their stools. So can be due to dietary or pharmaceutical changes. I know traveling, what causes some constipation? Traveling, eating different types of foods, eating on different schedules, throwing people off. And if you listen to what I just said, college and professional athletics are just, they are very difficult for athletes to get on a consistent schedule. And sometimes it may really lead to gastrointestinal problems. So treatment: increase fluids, increase fiber. We might use some over-the-counter medication, Metamucil, or something stronger. Just be careful with that. You don't want to induce diarrhea. And then refer if there's problems that are ongoing. Okay, there's a couple more here. So gastroesophageal reflux disease or GERD, heartburn. You'll know because it's going to burn right through the esophagus. This is stomach acid traveling up past the esophageal sphincter. Usually we don't have this, but it can happen, especially after eating certain foods or a lot of them. So high-fat meals where we get that stomach acid going might pop back up. Family history. Was someone just exercising? Is there something out of the norm? So signs and symptoms: chest pain right through the middle, burping, chronic cough. Maybe it's getting into their throat so they're losing their voice. And then what do we do about it? Maalox, we might do milk, Tums, anything like that. If it's bad enough, we refer and send them to the doctor. Ulcers. Ulcers are a big problem. They are not fun. Can be caused by NSAIDs, can be caused by alcohol, so just be aware of that. Always go to the cause if you can. Try to identify the cause and treat that. Signs and symptoms: abdominal pain, nausea, eating can aggravate symptoms. They'll feel worse. Night pain, and then if severe, blood in the stool. So treatment, we're gonna try to do things. Again, some of these up here are actually also helpful for stomach ulcers. Milk, H2 blockers, see if there is a bacteria. Okay, IBS, irritable bowel syndrome. If you have an athlete with irritable bowel syndrome, it is likely that they have known about their symptoms for some time. It's a chronic condition. Unknown cause, usually younger than 35 is when it starts. Like I said, most people that have irritable bowel have been dealing with it for a fair amount of time. Irregular muscle contraction of the stomach and GI tract is one of the things that causes it. Stress triggered. It does seem to have some genetic components. Signs and symptoms becoming pretty common, or we're seeing these over and over. I would refer in these instances, if you have someone that's kind of meeting the criteria for irritable bowel, where they just are constantly having gastrointestinal issues, I would refer. Those clinicians will rule out other infections and inflammatory diseases, maybe do a colonoscopy, and then get them diagnosed. There's some good medications for irritable bowel now. Treatment, prescription, and lifestyle management, and then athletes can play. Appendicitis, this is McBurney's point. So McBurney's point, we're talking about this right lower quadrant, this vermiform appendix right there. People with this are going to have pain. So remember, if it's an appendicitis, it's just inflamed. If it's an appendix rupture, that's going to be a big deal, and we got to get those athletes to the treatment quickly, because they're going to be spilling their stomach contents into their abdominal cavity, and that becomes a emergency condition pretty fast. So signs and symptoms: stomach pain, pain in their belly button area, tender to palpation at McBurney's point. We can do this as part of the lab. May develop a fever, nausea, vomiting. Like I said, if someone has pain here and they start to develop a pretty good fever, you need to get them to the hospital quickly to make sure that hasn't ruptured. So cholecystitis, related to the gallbladder, inflammation of the gallbladder, cholecystitis. So various causes. Gallstones are part of them. Could be other things, but could be gallstoned. Signs and symptoms: right upper quadrant pain, long-term blockage, so they have a tough time. People with gallbladder problems may notice changes in their stool because they're able to not digest things as well as they have in the past. Additionally, they may have problems with high-fat meals in particular. So if an athlete is complaining of these, we're going to refer for the right upper quadrant pain, or if they are complaining of changes to their digestion. Removal of the gallbladder is becoming more and more common, and then the surgeon will determine things there. Inflammatory bowel disease, so Crohn's disease, ulcerative colitis, small intestine and large intestine. Chronic pain, diarrhea, can be bloody, leading to lack of blood cells. I would refer all the time in this instance, and they will get it figured out. And then finally, the most severe scenario, colorectal cancer. Lots of people develop colorectal cancer, not at a young age, but as you age, you will know people that develop colon cancer or rectal cancer. Risk increases with age, and then if it's in a younger person, it's usually more aggressive. So signs and symptoms, again, just abdominal pain, blood and stool, anemia, change in bowel habits. This is just such a big one, you guys. I would just stress that over and over. If you have an athlete that has a consistent change in bowel habits that is not explained through diet or through stress or other things, then it's a cause for concern. Okay, so like with all things, family history is good, and then I would just refer. Okay, and that finishes this video on conditions of the gastrointestinal tract.